when they put him in that situation where you already have Mike Pence debating, Kamala Harris, a black woman, then you have the moderator, which is a woman as well. And I felt like in a situation of debate, it's very hard as a man to, just continue to talk over women and not really think anything of it. You know what I'm saying? And I feel like in debate that can happen naturally, but the fact that it was like looking like from the viewer it was him talking over women, I already felt like
he already was but he also was talking over her many times in the debate.
Yeah.
She had to even say like, excuse me, I'm speaking right now, can you give me my time? Many times.
Yeah. I'm speaking.
My favorite part of the debate was when they actually started talking about stacking the courts, and Kamala fired back and was like, let's talk about stacking the courts.
Yeah.
Why, out of all the justices your administration has put up since Trump became president, how is there not one black person?
Yeah, I definitely think she hit home with that point.
He's appointed over 50 justices in his presidency. That's crazy.
And not one is black, as she said. And I love that she brought that. It was like the best thing she could have said.
He had nothing to say. He was just like, let's get back to what the real question is. Are you guys going to stack the courts if we don't give you as if we elect Amy as justice?
And I thought that was so funny. I think it's so funny, this game that the Republicans are playing right now. Because I mean, as a viewer, I'm looking at this like, these Republicans are literally trying to shift the blame onto the Democrats for what they're doing right now.
Oh yeah.
And that, like, talking about stacking the courts, asking the Democrats, are you going to stack the courts? No, good and well, y'all are stacking courts right now, advocating to continue to do that. Oh, they're going to stack the court. Oh, why won't they answer the question? Like, are you kidding me? How do you think that we should vote? Do you think someone should vote their interests over voting, with the quote-unquote majority, or, what they feel is morally correct?
I feel like you should always vote the way you feel for the best candidate. Like, whatever your interests are, or whatever you feel strongly towards, whether it's healthcare, education, or whatnot, I feel like that's the candidate you're to lean towards. So, I mean, I usually lean towards Democratic since I've always started voting, but the party has been changing for me as I've gotten older, so I honestly can't say I fit with either. But in this election, I'm going to vote Democratic because we need Trump out. Hello. Hey, how are you?
Hey, I'm good. This is Lyric. Calling from Arizona.
Where are you from?
I'm from Austin, Texas, but I'm living currently in Arizona right now. So good morning, good afternoon for others.
Hey, Lyric. Thanks for tuning in, and thank you for calling in the show.
Definitely.
We appreciate it.
Oh, cool. So just to kind of give you like some background is, so I've been in the healthcare industry for about 6 years now. I have worked for, used to work for CVS Caremark in the Medicare department, so I would know Medicare guidelines in and out, how it works. And then also I've transitioned from there to my current employer, which is another health insurance company, who I've been with for the last 3 years, in the medical, pharmacy, and dental side, all in one, and just providing that also guidance and information that they need to be able to best maximize their health insurance that they have today. The reason why it is super important about the ACA is because
the ACA being the Affordable Care Act. For those of you guys who don't understand.
Affordable Care Act, yes. Sorry for the acronym.
You're fine.
To a minimum. So the main three things that the Affordable Care Act does is it makes affordable health insurance available to more people. The law provides consumers with subsidiaries, which is premium tax credits, that lower cost of households. Basically, if you have a lower income, they are able to subsidize the premiums of the health insurance and also subsidize the cost that you pay out of pocket. Subsidizing meaning that they help pay a portion of your health insurance as you pay the lowest cost possible. Let's say that during this time you just found out you were pregnant. Yay, new baby on the way. However, when the ACA, if they get rid of these pre-existing conditions, your employer, whoever you may work for, may say, we don't want to cover you because a pregnancy is a condition. If you're in the insurance industry or even in billing, you'll know that that is an actual condition. It comes with a diagnosis code to be billable. So with that being stated, they can say, you know what, and if you're high risk or not high risk, hey, we don't want to cover this condition, and they can choose to cover you or not the pregnancy, or they can choose to not cover you at all.
Wow.
Now, the average cost of a birth, vaginal birth, ranges anywhere between, if you go from a birth center to a hospital, can range anywhere between $10,000 to $30,000. If you have a high risk maternity,
I think this is where they say babies are expensive. This is where it comes into this. I think this is why they say babies are expensive.
Wow.
Oh yeah, and even if you have a C-section, let's just say you plan your whole 9 months, you plan to have a vaginal birth. Something goes wrong, baby turned upside down, the umbilical cord is wrapped around the neck, and you have to get a C-section that day. Now, that just tripled what you're going to owe 3 times. There are people that levy their homes, take out reverse mortgages on their homes, or have their elders do that for them. There are people that file bankruptcy after medical bills. This is not a secret. It will ruin you if they get rid of that, because for any good reason, they don't want to cover you because they feel like it'll be too expensive.
Do you guys hear this?
They don't have to.
Do you guys hear this? So now, just hearing, thank you so much for calling in, Lyric. We appreciate your expertise in the insurance and billing industry, especially in healthcare, because now you guys can understand what we say about how so many people will lose coverage based on pre-existing conditions and how important it is. And it's not about what party is doing this or not. It's actually just about what president is not going to take this away. And right now, that's looking like Biden. So thank you so much, Lyric, for calling in. We appreciate it. St. Lamore wants to ask you a question.
I do have just one last question on the wrap up of that, because I do see Trump trying to remove the ACA, and I'm wondering why would he even want to do that? And then my question to you is: are there people in healthcare that are actually for removing the ACA, or is this something? I'm just trying to figure out, why would someone want to take this away in the first place?
I think a lot of people misconstrue. A lot of people, and from what I've gathered, will want to remove the ACA. One, it has something to do with Obama, and they're trying to redo or outdo Obama, and not realizing how detrimental it is to our everyday life. And I can give you an example of when a lot of, back in 2018, when a lot of health insurance companies started to pull out of marketplace plans, right? A lot of them.
Marketplace plans being plans provided by jobs.
The state.
Okay.
That'll be. I'm sorry. Okay, so marketplace plans are going to be government-funded plans. So these are plans that you do not have with your employer.
Okay.
So a lot of health insurance companies pulled out of marketplace plans because they were losing a lot of money. Once the ACA became up in the air and started to back out of that and basically trying to save money because they didn't like it, people started calling in. Hey, how much is my prescription going to be this year? Something they used to pay $4 for a generic, now just shot up to $500 for a generic, right? Because
let's talk about insulin prices too.
That do not offer what marketplace plans offer.
That's very true.
I see.
Right? So anybody who is well versed in healthcare knowledge, ACA, is not going to want the ACA repealed. Okay? Unless there's going to be something that includes that policy language that is going to allow us to continue to
covering those people, yeah.
Outside of that, to have that removed and for Trump to have no plan on how he's going to enact.
He has absolutely no plan. He has absolutely no plan. I hope you guys can hear this, because at the debate, Kamala asked, what is your plan? Do you have a plan to cover the people that you are about to pretty much take away coverage from? And Pence had nothing to say. So you're right. Continue.
And even Obama had nothing to say. He says, we have something in the works. We're working on something. Well, what are you working on? Because the question is now going to become, if you don't have something comparable or something equal to what we currently have, it's not going to be better, and I can guarantee you that. I can promise you that. It's not going to be better, and it's going to hurt more, and it's going to cost more.